Proper mask wearing is also part of a new roadmap released this week by the American Association, of Medical Colleges to try to help us navigate this pandemic.
Well, joining us to answer questions about the guidelines and masks is Dr. Atul Grover. Dr. Grover, thanks so much for taking time for us. We appreciate it. Did want to ask you about wearing face masks. This has been a divisive issue across the country. Should we all be wearing a mask?
Thanks for having me. We should all be wearing a mask inside and outdoors if we're going to be within 6 feet or less of anybody who's not a family member. And those recommendations are for all people ages 2 and up.
So what do we need to know, doctor, about the proper way to wear a mask, the places where we need to wear masks? What do we need to know?
Well, in terms of the places, again, I would say inside or outside, if you're going to be within 6 feet, that's part of the social distancing or watching your distance between people, washing your hands, wearing a mask. That mask should be a cloth mask. It should be well fitting so that you don't have big gaps around your face. It should cover your nose as well as your mouth all the way down to your chin. And where possible, you want to have a mask with at least 2 layers, preferably 3.
And doctor, what are some don'ts about wearing a mask?
Well, you don't want to wear the same mask over and over again without washing it or changing it out if you're wearing a disposable surgical type mask. You don't want to put that mask down. And the biggest thing is you don't want to leave home without it. So think about this as being an extension of your cell phone or your keys or your wallet. You just don't know when you're going to be within 6 feet of somebody and not be able to back up if you're on a close trail or some other close proximity. And better to have that mask with you just in case than to think that you're not going to need it.
We all want certainty, Dr. Grover, but I guess with a pandemic like this, it's impossible to say that, for example, wearing a mask would protect us 100%, right?
Right. So there's nothing that can protect you 100% of the time. But we do know that those 3 things that we can all do: wash our hands or use sanitizer if water's not available, watch your distance between people, try to make it at least 6 feet or greater, and wearing a mask. If we all were to wear a mask, in fact, if we got upwards of 80 or 90% of people wearing a mask in interactions, avoiding really dense crowds, we know that we could start to bring down the spread of this virus 2 or 3% at a time at a national rate. And really, while you're not talking about 100% protection for both people wearing the masks that happen to be interacting, you're talking about a level that's getting upwards of 80, 90%. And that could be the fighting chance that we all need to give our first responders, our scientists, our clinicians out there a great chance to help us get this under control while we wait for therapeutics and a vaccine.
Yeah, we need to get those numbers down and wear the mask all the time. Dr. Atul Grover, lots of great tips for us on how to wear a mask correctly. Thank you.